Hello everyone, I am Dr. Neema Sharma, Director Gynecology at Fortis Flight Lieutenant Rajendra Hospital. As we all know that we are battling through the second wave of COVID-19. Now all pregnant women will have a lot of queries about pregnancy with COVID, how to take precautions, what basic steps you need to take, what about vaccination in pregnancy and breastfeeding. So today I'll try to answer all these questions regarding management of COVID-19 in pregnancy. To start with, I would like to tell that the risk of getting COVID-19 infection in pregnancy is similar to that in the non-pregnant state. It is not that a pregnant woman will have increased risk of COVID infection. So the risk of infection is same, but the infection in COVID-19 can be a little more serious. It can lead to a more serious disease. It can lead to ICU admission, increased risk of high blood pressure, and even preterm deliveries. So it is important to take precautions to prevent COVID-19 infection in pregnancy. Precautions would be the same, like wearing mask, social distancing, avoiding public places, hand hygiene in order to prevent infection. In addition to this, we as a gynecologist also have a role to play in it. It is very important that in low-risk pregnancies, the visits in the hospital can be reduced to a minimum of about 4 to 5 in low-risk pregnancies. Yes, definitely in high-risk pregnancy, you will need more of OPD visits, but low-risk pregnancies can be managed only by 4 to 5 visits in the entire pregnancy. In addition to this, teleconsultation. This has really helped in last 1 year to reduce the number of visits to the hospital and to reduce the risk of exposure to these pregnant women. Regarding COVID vaccine in pregnancy, there was a guidelines by FOGSI. FOGSI is Federation of Obs and Gynae Society of India, that there is no yet evidence that these vaccines can be given in pregnancy, but they also stated that the benefits of the vaccine during pregnancy are much more than the risk. But still now, we don't have any strict recommendations from Ministry of Health and Family Welfare whether vaccine can be given in pregnancy and in breastfeeding. We are still waiting for more evidence, more clinical trial to recommend it in pregnancy. I would also like to clear some myths about vaccination in any woman. There was a myth in between that vaccination should not be given when a girl is having periods. No, whenever you get an opportunity, take the vaccine. Vaccine should also be offered to all women who are planning pregnancy or who are even planning intra-IVF pregnancies. They should take it whenever there is an opportunity. And if suppose inadvertently the vaccine is given to a woman while she is pregnant, no problem. It has been proven that these vaccines don't have any effect on the baby. They don't cause any teratogenic effect on the baby. So if inadvertently it is taken during pregnancy, it is okay. Now it's very important to know that COVID-19 infection in pregnant women is not transmitted to the baby during pregnancy, during labor, and during breastfeeding. There have been few case reports suggesting that yes, there can be few transmission, but till now there is no evidence to prove that there is transmission to the baby. Usually COVID-19 infection in pregnancy is usually mild. So first thing is, please don't panic. If there are symptoms, if COVID-19 RT-PCR is positive, isolate yourself. Isolate in a room which is well ventilated, sanitized, wear a mask. Then simple things like steam inhalation, saline gargles need to be continued. Strict monitoring is important. She should regularly monitor her oxygen saturation, which is measured by a simple device called pulse oximeter. And if any time saturation is less than 94%, she needs admission. It is not just one reading which is important, but it is important to monitor the trend of oxygen saturation. If on day 1 it is 99, but on day 2 it is 97, day 3 it is 95, that means it's falling. And that means she will need admission. So besides monitoring of pulse oximeter. She needs to monitor her temperature every 4 to 6 hourly. She needs to monitor her respiratory rate, which should be less than 24 min per minute. If she gets fever, she can take paracetamol 650 milligram up to 3 times a day. She can take zinc, vitamin C and vitamin D3. It's very important in pregnancy to avoid unnecessary medication. Unnecessary medication. Ivermectin is not given in pregnancy. Steroid should not be just started in pregnancy. It should be started only if indicated. Only if there is continuous fever for more than 5 to 6 days, or if there is a persistent intractable cough. Yes, then it should be given, but not as a first line treatment. If she gets cough, then steam inhalation, saline gargles, cough suppressants, some cough lozenges will help. In addition, nebulization with budesonide can help if there is intractable cough. During home isolation, it is important that she is in connect with some obstetrician or a physician so that she can discuss all her problems, and in case of some emergency, she needs to be admitted in the hospital. So during her home isolation, it is important that she should be aware of all her danger signs or red flag signs when she needs to come to the hospital for admission. Once she is fine, once she is asymptomatic for about 10 to 14 days, she needs to come for her regular pregnancy visits. It's important to evaluate the baby and for regular checkups. It is important that RT-PCR is not repeated again. It doesn't help. So RT-PCR should not be recommended just to see that she's not infective. If she's asymptomatic for 10 days or there are no symptoms, or if she's asymptomatic with RT-PCR positive and no problem for 10 days, then she's free, and but she needs to take precautions, but she doesn't need to repeat her RT-PCR. So while a pregnant woman is on home isolation and she's following all her monitoring, any danger signs will need hospital admission. Now, danger signs can be breathlessness. She can't even speak. She can't even walk, or there is palpitation, severe headache, intractable fever, loose motions, or her oxygen saturation is less than 94%, falling trend in oxygen saturation, or any obstetrical indications like labor pains, leaking, bleeding, or patient is having decreased fetal movement. All these are danger signs. And during all the danger signs, she needs to come to hospital for admission. In addition, any high-risk pregnancy like uncontrolled high blood pressure or uncontrolled diabetes mellitus, or patient is on immunosuppressants, or chronic kidney disease patient, she will need hospital admission. So before that, I would also like to comment on this, that COVID-19 infection in pregnancy is not an indication for termination of pregnancy. Many people come up with, I'm COVID-19, terminate my pregnancy, or it will worsen my pregnancy or worsen the health of the woman. So it is not an indication for termination of pregnancy. Even during her term, when she's 9 months pregnant, that is also not an indication for termination of pregnancy. So termination has to be done only if there are obstetrical reasons for it. But otherwise, just an infection is not an indication. And COVID-19 infection is also not an indication for doing cesarean section. That is also reserved for any reason, for any obstetrical reason of doing a cesarean section. The incidence of postpartum depression in India is already very high. It's about 15 to 20%. And this COVID-19 pandemic has resulted in a lot of depression in all the vulnerable groups, maybe a teenager or a pregnant woman or just after delivery. So postpartum anxiety, postpartum blues, postpartum depression should be addressed. It should be picked up by the family members, should be discussed with the doctors so that adequate counseling can be done, and if required, treatment can be started. So this should not be ignored after delivery, and proper assessment is required to rule out postpartum depression. So few take-home messages before I conclude my session. Most of the infection in pregnancy is mild, so please don't panic. Look for all danger signs while doing home isolation. Avoid unnecessary medication. After delivery, please breastfeed the baby. Assessment for postpartum depression is very important, and I hope we get vaccine for all our pregnant and all our lactating women.